Hey guys, we are here at Atlantic Health Systems, Atlantic Sports Health, with Dr. Monaco, who's a member of the Atlantic Sports Health team here. But before that, for 21 years at Rutgers University, overseeing all of their sports medicine for all athletic teams. First of all, congratulations on all your success, Doc, and helping put Rutgers on the map over the last decade or so, and now here at Atlantic Health Systems. I know you spent a lot of time working with athletes at all levels, and I know today you're going to talk to us a little bit about biologics, which is really, really interesting stuff.
Yes, it's really at the forefront of where medicine's going, particularly sports medicines, using biologics and cells to treat injuries on that. We had a vast experience down at Rutgers during my time there treating elite athletes, and we're bringing some of the technology here to the everyday athlete as well.
Wow. So give us some case examples. First, what is biologics? How does it work? When would you implement it, in a case?
So biologics is basically using your own cells to help the body, trick the body into getting a more reparative or healing process going on. So the more we can tell the body to bring cells to help heal, the better we're going to bring a healing response. We all know that the young person, when they have an injury, heal really quickly. Well, in certain injuries, we need to accelerate that healing, or if you're an older person, you might have a delayed or not as robust healing response. So using your own cells can help really stimulate the body to get a better healing response.
Wow, that's amazing. I mean, the technology today in medicine and what you're practicing and being around athletes and high-level athletes and youth athletes for over 20 years. So go into a little more detail. So it's blood plasma? From what I understand, biologics, and you're taking blood from an area, injecting it in an area. Can you give us a little more?
So there's a lot of different ways to get cells in the body. The most commonly that people probably heard about is something called PRP, where we take blood from the body of the patient and we concentrate the platelets in the body, which the platelets are the areas that really help accelerate healing. Like when you get a cut, you get a scab, platelets are what makes that scab. So they tell the body to bring a lot of cells here to help it heal. So what we do is we pull the blood off, then we're able to spin it down and concentrate the platelets anywhere between 4 to 12 times what's normal, and then we are able to inject them back into the area of injury. What this does is tells the body, hey, I'm hurt here, bring me a lot of cells to make me heal. Make me heal either quicker or make me heal stronger in a better light than before. So this tends to accelerate healing and bring a good healing response naturally to the body. Quite a different response than when we do with what you might hear about with cortisone, where cortisone kind of shuts the body down from this. So this is kind of telling the body to make it heal rather than to slow the body's processes down.
Truly, truly amazing. And how many cases have you performed this on? How many athletes?
We've really been doing it for over 10 years and a lot of elite athletes, and now we're bringing it to not only elite athletes but to the everyday athlete, a recreational athlete. And we're finding now that this is even helpful in degenerative conditions like osteoarthritis or older people, where we can help quiet down their joints and help give a healing response rather than suppressing the problem.
This is really, really cutting edge. Biologics, it's interesting because it's completely natural. It's your body's own blood, right? Cells, and just concentrating it in an area that might need some accelerated repair, like a tendon or a bone or something that might not have the ability to repair itself.
That's exactly right. It's really unique. It's really the future. Now, that being said, it's still in its early stages of growth. There's a lot of research that needs to be done on this. We still don't have always times the right recipes in the cocktails to inject. And some of the data in some of the studies have been mixed. Everyone's cells are slightly different. Some people have different preparations that they're using. Some of the techniques to do the injections can vary. So some of our results, some of them are very positive, some not so positive. So a lot of work to be done. Really, people who do choose this need to see someone that does a lot of work and stays at the high levels of science of what's evolving on this to see what's forth. Because it's not a cure for everything. We have to keep doing a lot of research on it.
It sounds like you're absolutely on the cutting edge of this with your experience in it. And what are the downsides? It sounds like if you do the prep work and you identify a patient if they are qualified to maybe get this treatment, Are there any downsides to having this treatment?
Well, I mean, first off, since it's not well studied completely, cost is an issue. So insurance companies oftentimes won't cover this. So it can be a fairly steep cost for patients. So that needs to be considered on there. And conventional treatment should always be tried first. So that's always a downside to these issues. And two, the physician needs to carefully select out what they're using it for. We know it works better in certain problems than others. So the data in tendons is better than it is in muscles. The data in joints is starting to improve as well. On that. And then we have to figure out the different types of recipes. As we get older, our cells are not very as robust.
Right.
So in those cases, sometimes we have to gather cells from different areas of the body. Some people take them from either the bone marrow or even the fat. And that's more advanced and obviously is more technically challenging as well as more costly. So one has to be really careful and exhaust their normal treatment things first at this stage.
Sure. And lastly, if someone gets this treatment, obviously it works. Sometimes it doesn't work. If it doesn't work, is there any downside physically to the individual if it doesn't work?
Very rare that it causes a problem. It's their own natural cells from the body. So in this case, they're really not going to cause much of a problem.
That's what I thought.
It can cause a little bit of a reaction as we bring more cells to the area, which can hurt for a short period of time. And the patients need to understand in these kind of cases, we're treating this to get this better. This is not a quick fix.
Right.
So when we inject this, say, in your elbow, very commonly used in tennis elbow. When we do this, it's not going to get better the next day like we do with cortisone in a few days. The process is going to take 4 to 6 weeks to start to get better. Sometimes it needs to be repeated on this. So it does take some time. People need to understand how it's working, and this is more for the long haul rather than to cover up something.
Sure. And what are the most common injuries you see that you would prescribe biologics?
Yeah, in this case, tennis elbow or what we call lateral epicondylitis is probably the most common, where multiple studies have shown it's far better than cortisone in this for the patient in both the short and long term from both pain as well as helping the tendon heal. That's probably the most common. Other tendons are the patella tendon in the body, and more now we're seeing it more use in arthritis, where the data looks extremely promising as a treatment.
Well, it's for young athletes, old athletes, everyone in between and above. So, Dr. Monaco, that was great. Thank you so much. Biologics, new cutting-edge technology being pioneered here on Atlantic Health Systems, Atlantic Sports Health. Look forward to learning more. Thanks so much.
Thank you.